How's everybody today? Are we all well and good? Not if you're well and good.
Yes, we are.
Thank you very much. Good afternoon, all. And on behalf of the COVID Vaccine Prevention Trials Network, I wanted to thank you for joining this episode of COVID in Black, Black Women on Science, Health Literacy, and Clinical Trials. My name is Danielle Campbell, and I will be your moderator. In this episode of CoVPN's COVID in Black discussion series, we will hear from Black women who work in public health and social justice to discuss their perspectives on science, health literacy, clinical trials, and COVID-19. We will talk about how COVID-19 has impacted their lives and the lives of the communities they serve. The panelists will discuss the importance of increasing awareness and knowledge about COVID-19 clinical trials, factors to consider when making decisions to enroll in COVID-19 related clinical trials, and most importantly, what is needed to support acceptability and uptake of an approved COVID-19 vaccine in Black communities. Before I introduce the panel, I wanted to offer an additional disclaimer that the views and statements made on today's discussion by our panelists are their own and may not represent the views and positions of their home institutions, the CoVPN, or other entities that they represent. With that said, I will list the names of our esteemed panelists, and then they'll take a minute to introduce themselves. So Ms. Kaida Mutepa, a community advocate based in New Orleans, Louisiana. Kaida. Vanita Ray, Deputy Director at Positive Women's Network in Washington, D.C. Ms. Vanita. Next up, we have Ms. Meta Davis-Smith. Ms. Meta, Assistant Director of Prevention at Heart, HIV and AIDS Alliance in Baton Rouge, Louisiana. And last but not least, Dr. Kimberly Parker, a public health consultant based in Dallas, Texas. All right, y'all, it's your show.
Okay, since nobody said anything, I'll go first. My name is Meta Smith Davis, and as stated, I'm the Assistant Director of Prevention at the Heart Clinic here in Baton Rouge, Louisiana. I am also a coordinator for the Framework for Dialogue, a project where community members, service providers, and the faith community are getting together to come up with initiatives and strategies to tackle reducing and eliminating HIV stigma.
All right now. Thank you, Ms. Meta. Next up, hey, Ms. Vanita, welcome. Next up, Kaida.
Hey, good morning, Black people and everybody else. Kaida Mutepa. I am here today as a taxpaying citizen of the state of Louisiana. And I am a social worker all day, every day. Will always be a social worker, public health advocate, research advocate, and a whole bunch of other stuff. So thank you all for this opportunity.
Welcome to it, Kaida. Ms. Vanita, be with us.
Hey folks, how y'all doing? Vanita Ray, she, her, hers, happened to be co-director of the Positive Women's Network, doing work never expected to do after being diagnosed with HIV in 2003. I'm coming to you live and in living color from Houston, Texas, where another Black man was killed by a police officer this weekend. So I've been in tears all morning. I'm bringing my perspective of Black folks who are and looking at the issues we're looking at from a structural systemic perspective, a racial justice perspective, and no holds barred. I don't play the games of, kumbaya. We got some work to do. So good to be with y'all and my sisters who I love and appreciate.
Next, Dr. Parker.
Good morning, everyone. I am Kimberly Parker. I am currently working and serving as an independent public health research consultant. I served as a former associate professor, and I think in this role, I have never, in the role of being independent, I have never experienced so much freedom and joy. I am also the chair of the board for the Southern Black Policy and Advocacy Network. And to the panelists and moderators, I look forward to it. So let's have at it.
With that said, we can start off. Just describe for folks, how has COVID-19 impacted your daily life? And that can be from a personal or professional lens.
So I don't mind starting that. I wear a number of hats. I introduced myself with a few, but from a work perspective, from a personal life, I live alone. I was just telling somebody, I typically travel and have the privilege of working from home and doing a lot of things. And so I've been pretty isolated since March, right? And luckily not hungry, and so got all that taken care of. But dealing with my own emotional health, I have to learn another level of collective care. I was feeling survivor's grief, and just because there was so much despair going around me, I've had more deaths this year than I can even think of the names of, starting with my grandmother who was 100 in January, and so dealing with my own of despair, trying to find a way to balance social media, news, get that energy out my house. So my own, I have staff that I'm trying to manage, Black and non-Black, from their remote around the country. And so how do you manage workspace and dealing with Black issues, but non-Black folks who are trying to be passionate, but don't get it, but want to get it. And so having to navigate that. And the work we do is social justice, racial justice, having to examine, are we doing enough? No, we're not. And looking at that. So managing that, and what does that look like? I have staff that are home because homeschooling, giving a sister more time and helping her with her internet so that she can be able to homeschool her son in the midst of this. And then the third level is, if you don't know, Positive Women's Network, Meta knows, and Kimberly and I know Kaida knows, is a membership organization for women and trans folks living with HIV. So we're a national organization. So dealing with just the national membership of everything they're going through with another stigmatized infection, another stigmatized virus. The language alone is just like somebody on a chalkboard, dealing with eviction, loss of food, loss of jobs. They're the essential workers, so there's more than one level of what's going on. And I'm the privileged one, even in the midst of that, but trying to manage all three spheres of it. And then just the rest of this nonsense of the crap that we call political lack of leadership. It is just, yeah, I'm angry. I thought this was canceled, so y'all really getting it. But so there's just a whole lot of levels to managing COVID. One more thing that folks say ain't real, but yet most of us are still dying from it. And we want to talk about health disparities all of a sudden now, and we've been talking about that for years. So yeah, there's a lot going on managing today.
We hear you. We receive it. Serve it, Miss Vanita. It's early. Okay, serve it. Next panelist. Who wants to respond?
And I'll just add, thank you to Vanita for sharing. I think the most important thing about COVID is to understand that your experiences and your feelings are real. And, I'll speak to the mental health aspect of it. It's a double-edged sword in that it warms my heart to see so many people willing to admit and state, that they have or are going through mental health issues. But it's also discouraging in that we understand and we know why. And even if we just look at the basis of COVID, again, like Vanita said, the isolation. And I'll just say, as somebody who has a mental health issue, I suffer from adult ADHD, which is the poster child for anxiety and depression. Had I not accepted that and not been shamed of it before COVID, I think my response to it would be different. Or in other words, not being ashamed of my experiences has personally helped to save my life. And it's just something that we have to give honor and validity to, because we are, as Black women, or as individuals, people whose experiences are real. And you know, if nothing else, not the trope that people have made us out to be. And I think for me, that has been the most impactful aspect of it.
I know. Thank you for sharing that.
Thank you. You're welcome.
Danielle, thank you for asking the question. And Kim, thank you for that. And Vanita as well. When Vanita was talking, I was just sitting there saying, wow, like the weight and the load of human lives. You are responsible for human lives during a pandemic. Like, but I am so grateful for the work that she's doing, and so grateful for the work that PWN is doing. Because imagine what lives would be like without them. Right. So for me, you know, we during our call yesterday, Danielle, we were talking about pandemic parenting hashtag pandemic parenting. I don't care if you are parenting your parents. It is hard. It is really hard. For me, the number one reality, and I was sharing this with Miss Meta, is that you know, you look around at your child or children and say, what did we do? I didn't know that we did that. Meaning, you know, they are temperamental and frustrated and feeling enclosed. You are temperamental, frustrated, and feeling enclosed. You don't do Common Core math and you're wondering, why is it Common Core math anyway? In addition to, you know, the whole motivation of, can you get up and brush your teeth today? Like, can we just start with brushing your teeth today? So pandemic parenting is real, because then you feel overburdened of, so who do I call to say, come and get this child, and then not, you know, subject that person to the same thing that I'm dealing with. So luckily she's a good girl. However, the various dimensions of setting an example for her has been, it's been a stretch. You know, those moments when I just say, I don't want to, or I'm tired. I have to think about, what example am I setting for Inyasha? What example, how does she see me showing up for life? How does she see my vulnerabilities, and how am I transparent with her about the things that make me afraid? My daughter is in in-person school. She attends a Catholic school. And you know, money talks. And so when money talks, the science becomes second nature. So of course, when we entered into that relationship with making the decision, allowing her dad and I allowing her to make the decision to return to in-person school, because she had a virtual option. But, you know, it's about how she chooses to live her life right now, because her peace of mind is important. When she chose to go back to in-person school, at one point, she was like, Mommy, what's wrong? And I was like, I am scared as crap. I feel like I am sending you out into this wilderness. I cannot control it. I cannot control if people do temperature checks. I can't control hand washing. All of that stuff I can control under our home. But when you're out in the world, oh my God. And it was a shift from the nesting that we were doing. Because at the beginning of COVID, you know, we were delivering food to elderly and homebound people, and we were nesting and learning about each other. And then August came, and I was like, I don't like her. So pandemic parenting, it is real. I'm thankful for it, though. She won't let me get a dog, so I'll just leave it at that. Wow. She doesn't want any more responsibility.
Well, Kaida, thank you so much for sharing your experiences as a pandemic parent. I'm sure other folks can relate. I read somewhere that 1 in 3 women who have considered leaving their job, or 1 in 3 people who consider leaving their job during this whole COVID-19 pandemic, are women. So I think we can relate to your experience, and thank you for speaking to that so transparently in this space. But I did want to ask, and this is to anybody on the panel, what are some of the ways that you've seen or heard COVID-19 impacting HIV prevention and treatment services as part of your work or your advocacy?
Well, let me get in on some of this.
Come on in, Ms. Meta.
I do HIV work. And also, let me say that as a person, as a Black woman living with HIV and who takes her mental health medicine on a regular, so the rest of the world can be safe. I think that for this whole COVID-19, is that for Black women, we emote. We do that. We like to hug. We like to touch. When we laughing with our sister girls, we like, girl, you know, and slap us on the back and high five. So it's affected me emotionally because I can't do that with my sisterhood no more. I mean, we do Zoom drinking. We do a lot of Zoom drinking, but it's not the same as sitting in the room and holding my sister's hand when she's going through something, or when I'm going through something, having to talk to my sister through Zoom as opposed to her hugging me through it. And as a HIV prevention specialist, what it does, I look inside when I'm having these conversations with my clients with this sneeze guard up there. And the whole time that I'm reaching inside, looking for something to empower, educate, or enlighten, I'm telling you, my ism of self-preservation kicks in and says, how long is this going to last? I wonder if they had a COVID test. I wonder if they'd even tell me if they did. And Lord have mercy, is it time to leave yet? And that's real for me. Even when I'm providing these services where I want to be the best meta that I can be, I'm still plagued with that ism of self-preservation.
Talk about
That's
it.
a challenge.
Talk about it. Others want to weigh in?
Well,
For me,
go-
you want to go, Dr. Parker? I was gonna say really quickly, if I may, really quickly, that you know, since the beginning of the pandemic, those of us who are privileged to work in HIV, for me, this December it'll be 27 years being aligned with the miraculous virus known as human immunodeficiency virus. And I think that what I've said since the beginning of COVID is that this is our time. And what I mean by that is, as individuals, people, the collective, a community, those of us that have worked in this area, we understand very clearly, number one, what is a virus? Number two, what it does to the body and how, right? And then number three, the social, emotional, and economic impact of a virus, right? We have about 4 decades and some change where we have been able to be front and center and present. Another thing about HIV that a lot of people may or may not know, I'm not sure, is that HIV was the only disease to receive a $90 million allocation in the CARE Stimulus Act. And so for me, I think about all of those fearless advocates that have either laid their lives on the line, who continue to lay their lives on the line, and who ensured that our Congress knew how important the work that we're doing is. The last thing I'll say is, those of us that work in this field, you know, it's a giving field. Like someone said, like Meta said, you know, we are a communal people. You know, typically the U.S. conference on HIV would have occurred in September, and during that weekend following Labor Day, I don't know about y'all, but I was like, I don't have no outfits to get ready. Like, I don't have any text messages to send, no plans. And then as the days like approached, I was like, so who do I meet up for drinks? Oh, I can't call like my girls. And oh, wow. And what about all those hugs, like every 5 seconds? someone was hugging your neck, someone was telling you you were beautiful, or that you were amazing, or that you were smart, or that you were something, right? Because it was such an affirming and beautiful space. And then September 10th came, and I was like, I guess we ain't going nowhere, y'all. So I think realizing that we work in this field, we have such a beautiful opportunity to translate and transmit all of the learnings that we have had, especially in relation to this conversation we're going to get into in a minute, because, this is not a new topic. We just keep on talking about it as if it is, but, carry on.
Indeed, I will. Dr. Parker, please take yourself off mute and comment.
So I concur. And for the sake of, it also goes into some additional questions. We can move on. I'll just say, with those who have responded, I concur. But I see that I'm going to yield to Vanita.
Oh yeah, and I so appreciate you yielding to me,
anytime.
beautiful Black sister. But I want to say the ways that I've seen as a woman living with HIV. I don't do direct services like Meta and all that, but I do talk with tons of women or social media and whatever, and the very few support groups that were there ain't there no more. Access to being able to go in and talk with your doctor. We were already treated like we were a walking infection, and now COVID too. So there's some added stigma. I mean, I know some people who are living with HIV who've gotten COVID and ain't told a soul because they can't deal with the double stigma of, now, how did you get that too? I'm hearing some of the same language around what we hear living with HIV refer to people with COVID. So how'd you get it? And folks twisting themselves in the knots trying to figure out how they got it when it ain't our business. And the reality is how they got it ain't the issue. And so I see I see access being limited to people, and Meta talked about that, and other folks. We are relational. USCHA, I love it, but I'm not the most social person, but it is always good to see the power in people and numbers there. So support groups are limited. Other needed services, transportation, all kinds of other services have been impacted that women need and depend on, or other people living with HIV. PWN, we raised some money, $10,000 for an emergency fund for groceries, rent and stuff. That money went so quick because the need is greater than we can handle. So, there's issues around contact tracing, which we know the world ain't did the greatest job around surveillance and respecting the privacy rights of people living with HIV. Never mind COVID. Let's not even get into criminalization that we're seeing of COVID like HIV. So those are all issues related to me of prevention and services. And then what we are also seeing is, I'm seeing funders coming out with emergency funds for direct services. I'm an advocacy and leadership organization. If somebody ain't advocating for it, chances are it may not be having. So we're all entering into some level of recession that we don't understand, that could have impacts on the bottom line of what people, medicine. I mean, is that pharmacy open at the hours that you can get there? Can you get on a bus with a mask? I mean, so there are a lot of ways that prevention services, advocacy, leadership, and the support network that is needed for people living with HIV has been severely impacted by COVID. Never mind the shame and stigma of it.
Wow. I'm kind of glad Kim ceded the floor to you so that we can hear that powerful response. Thank you for that, Ms. Vanita. But to your point, when you talked about, and Kaida mentioned it as well, some of the similarities that we see, some of the intersections between HIV and COVID. It's almost like we're in the early 80s and 90s of this epidemic.
That's right.
So let's talk about some of the lessons learned and some of the takeaways from your work in HIV and in public health that can be applied to COVID-19 and our response as a community of HIV advocates and activists and public health, aficionados. Talk about it.
And so I'll go first in this one. as a former professor, I would always laugh when, I would say to students, well, how do you plan on preparing for comps exams? And they would say something like, well, I'm gonna take a week off, and then, for 10 hours a day, I'm going to write and, study the questions. And it's a beautiful, well thought out plan. And I would say, okay, the last time you used or followed that exact same process, how did it work out for you? And they would look at me like I was crazy. And then I would say, because you never used or done that. So why come up with this new process now? As I think, as we sit here and we talk about the feelings and the emotions and the aspect of what's being expressed, ladies, this has been something that we have been saying needed to be addressed, not just in HIV, but, as in how we address social injustice and health disparities. And so I think the very first lesson to take home is how you feel or how you felt in the midst of COVID. Approach your work to address that feeling. And, when we were talking about, for instance, isolation, I am a time zone away from my closest family member. I have a 20-month-old niece that I have not seen since Christmas. And I am also the type of person where I'm on a roll. When I'm on a roll, I will turn my phone off. And in not realizing, in the isolation of being on a roll, in a situation where we are already limited with contact, the impact on us, and use that same approach or empathy, in all the work that we address. The other lesson I think that we should remember is stop forgetting what we already know. I mean, when we look at just the basics of an infectious disease, I'm gonna be honest, ladies, I had a problem with the fact that we had to remind adults to wash your hands. And so it's, I mean, that thing bothered me to my soul. And anybody who had a conversation with me, it was like, first chicken, legs, and now hands. We got to go back and convince people to wash their hands. And so we can't forget what we know, just the basics of our any approach to an infectious disease. Or for those of us on the panel, and also, the type of research that the moderator does, remembering that the reason why COVID impacted Black people is the same reason, or Black women, or just oppressed, marginalized groups, it's the same reason why all other health issues impact them. And so the beauty of not being disappointed, but not being surprised by the disparities, and having that gumption and that trust to pick up where we left off, starting from where we already know. Now, some people might say it's woke, but I'm trying not to use such common terms. But we got to remember what we know, what we've done, what's worked, and then also keeping that human aspect in mind.
Thank you for that. Just one quick follow-up question, Kim. When you talk about comps exams for the people,
yes,
what, sugar, are comps exams?
So, a comprehensive exam a comprehensive exam that basically tests everything that you've learned up to that point. And let me just tell you what the secret is. Do what you've done in the past that led to success.
Indeed. Any other panelists care to comment? Lessons learned and takeaways from your work in HIV that can help?
I think for me, it continues to be understanding and tackling stigma is key in public health efforts, both for HIV and COVID-19. I mean, HIV, I think what I learned coming through HIV was that stigma impacted every aspect, from folks being willing to come and get tested to find their status, to folks who knowing their status, not staying in care. They have people that I know who don't want folks to know that they are contracted COVID-19 because they don't want to be ostracized by their family, their friends, their communities. And I think if we have this collective conscience, if Black folks get this Black collective conscience that if you contract, COVID-19. If you contract HIV, that is not a character flaw. We have to deliver clear messages to all communities that they our people and we gonna take care of them. We're not gonna assassinate their character. We're gonna provide services that give them dignified services. We want them to be treated with dignity and respect until we collectively realize that, or when we hear somebody saying something negative about somebody that has contracted COVID, let's stop that in its path. A lot of times Black folks are still, well, they ain't talking to me. They could be. Mm-hmm. Because if you're talking to my sister in the negative way, you're talking to me in the negative way. And I'm not going to let you do that. I'm not going to stand around. I'm done with the days of passively standing by when folks saying misinformation or attacking someone's character. That's enough of that. I'm going to stop you in your track. And if you don't like it, I'm old enough not to give a damn.
Tell him, Miss Vanita, you were going to chime in.
I got something to say, but I want to know if Kaida does, because I see sister right there.
She's trying to come off mute. Is she hitting the button fast?
I know. No, I usually am. I'm terrible at this. No, Vanita, I'm waiting for the clinical trial stuff, so I'm good. I'm sitting possum.
Yeah. And we are segueing right into it, honey.
So let me comment on this, because I was wondering. I said, I know who Kaida is. I know who Dr. Parker is. I'm like, what the hell am I doing on here? This is not my thing, other than I will talk about Black women. So first of all, what have we learned? Racism is a public health issue.
Amen.
If we could stop debating this, stop putting the mic in the face of a white man saying, is there systemic racism? It blows me away every time we do that. When Black women get better, everybody get better. Let's just be real. So if we remember some of these kind of things, 60% of all the women living with HIV are Black. That ain't an accident. It ain't because we don't know how to take care of ourselves. It's because we're taking care of everybody else. And there's some systemic and structural issues. We live at the intersection of race and gender that nobody wants to talk about all of what that means. So some of the things we need to remember is, I'm not a scientist, so I'm gonna say this: biomedical solutions alone are not gonna solve COVID or HIV. And until we stop trying to approach this from a purely health issue without understanding the racial justice component to it, the cultural component, the social component. I live alone. Everybody don't have that choice. I ain't an essential worker. I get to do this. We have to deal with medical mistrust of science and medicine. You know, until 1987, Reagan never even said the word AIDS. Thousands had died. We might be saying the words now, but we are not doing the actions that the words mandate, because people are still dying. So advocacy in a system of care was born out of HIV. And one of my challenges with HIV history is you don't see enough of us in it. I'm gonna give you a name, Katrina Haslip. If it wasn't for a sister's name like that, we wouldn't even be in it, because there used to be a saying that women didn't get AIDS, we just died from it. And this sister right here from New York, who went in and out of jail systems, fought to get the kind of opportunistic infections that we got included in the definitions, so that Black women, or women as a whole, and Black women, I'm gonna say, because we dominate this, could be considered for the kinds of care that the white cis gay men were getting. So we have a lot to remember. We develop a system of care. We develop a system of advocacy. Wasn't perfect because it wasn't designed by us. I'm taking medicine that wasn't tested on me. And I'll let Kaida, y'all can get to that later. But we need to use that. We need to remember that Black folks were part of that history, and bring them back and remember what we did to get here. And we need to remember those sheroes like Katrina Haslip's, and one movie that I like, the women that will end AIDS. And I think it will be the same with COVID. So biomedical alone is not going to get us there. And I'll stop
if somebody don't say the benediction.
Oh, Lord. I was going to say, Mother Ray, can we please interrupt this public service announcement to move along? Okay. Thank you so much. So much. Okay. You had Kim testifying, you had Vanita tag teaming it. Oh, Lord. Okay. We must address some of these themes that you discussed. You talk about this prevalence of racism and how it intersects with medical mistrust. Let's talk about this medical mistrust and how it, how it festers into some of the biggest challenges that we see in Black communities and our lack of willingness to engage in clinical trials today. What does that look like in your work? Talk about it from your perspective. What do you know? Kaida, come on off mute now. You've been waiting. We've arrived.
I know, huh?
Mhm.
Man, Vanita was just, I just love Vanita. And
You call her Mother Ray.
so, yeah, that's right. But that's a heavy question. And the reason why it's a heavy question, Danielle, is because it has been asked and answered
Mhm.
a million times. And we keep coming back to the same point. And yesterday, one of the panelists and I were exchanging texts, and I said, whenever there is an element of unknowing or lack of clarity, oftentimes it has to do with who's asking the question, how are they asking the question, and if I think that they're listening. So if I don't think that you're listening, nor did you hear me, I'm going to continue to ask and re-ask and pivot that question in so many different ways. So if I'm coming to you seeking information about my health, having you to listen to me is going to be the biggest opportunity ever. And I'll share a personal example. This past January, I had a major life or health. My therapist and I called it a health awakening.
Mhm.
And this health awakening, could have ended another way, but I'm here. And leading up to the discovery of what was happening with my body was an activity of me contacting my OBGYN. And so I contacted my OBGYN, not because she was a Black woman exclusively, but because I knew that she would listen. I knew that she would take the time to hear what I had to say, to find out what I wanted to do about it, and then facilitate the process. And so because of that, it created this sense of empowerment for me, so that once I emailed her and her nurse calls me the next day, says, okay, let's do these tests, let's find out this, then it created this domino effect of Black women listening. And I was like, oh, okay, so the phlebotomist listened, that vein don't work, let's do this vein. Okay, the person at the ER listened. Okay, the doctors, the neurologists, the different people, they were listening. So because of that, I had the opportunity to be an active participant in my healthcare. Now, does that mean I was not faced with some really interesting feedback from people? I had one neurologist to tell me, I understand that something's going on with your partner, and we just have to deal with men, and this is a white woman, and she's at my bedside in the hospital. And it was a day that they wouldn't let me eat, and they didn't tell me they wouldn't go let me eat. And if you know Kaita, I was like, I want to eat. And they were like, no, you can't eat. Why can't I eat? Because we have tests. No one told me about these tests. You should have told me at 3. I would have ate at 3. So she comes in, and I didn't know patriarchy was on the breakfast menu at my bedside, saying that, you know, there are 4 things that we have to deal with men, you know, that start with MEN, the letters MEN, you know, menopause, menstruation. And she said 2 other words. And I just looked at her and I was like, are you done? So first of all, you gave me unsolicited advice because I have a therapist and I didn't need you to come in to comment on about how I need to deal with my social, behavioral, and emotional well-being. But more importantly, you're a neurologist, so just deal with my brain. And that what you're talking about is actually causing me more stress because you are superimposing your viewpoints, right? Your values onto me. And so as a Black woman, I don't appreciate that. The second thing that happened was while I was in this process, you know, I said to the hospital afterwards, to Emory Hospital, you know, no one ever sent a social worker, a psychologist, or a psychiatrist to talk to me. So as a Black woman, I came in telling you why, explaining how. And no one bothered to say, this may be it. You sent clergy. You sent clergy in there to ask me if I wanted to talk to clergy. And the fact that they did that, I was like, well, you know, I guess hey, we can talk. You know, I got my own direct line. I don't need an interpreter. But if he wants to come in and talk, that's fine. But it's the listening part of Black women. It's the listening part of Black people. It's not only the listening, but the affirming. Do you hear what I'm trying to say? And if you don't make an assumption. Don't draw an intellectual conclusion. Ask the question another way, and then you may get another answer.
Indeed. Thank you for that, Kaida. So listening, right? Just listening is one of the biggest challenges that you see facing Black communities from engaging in clinical trials today. Any others want to weigh in? My researcher on the panel. Let's have it.
Yeah, we ain't forgot.
What you ain't forget?
We ain't forgot about the HeLa cells either.
Oh.
And I think a lot of we ain't forgot about it.
What is HeLa cell?
A lot of times people don't realize that getting Black folks, first of all, if you want Black people in the community to participate in anything, then you need to get Black women on board. Because that's where the power lies, right there. And I think
so. Wait, Miss Meta. Now, when you say Black women on board, are you saying on board throughout the trajectory of the initiation, development, implementation, monitoring, and evaluation?
Let me keep going.
Go for it. You have it, Miss Meta. Let's have it.
When you get Black women involved in everything, you can't come to me. I'm talking, this is my perspective. You can't come in my community for no kumbaya moment. You can't come for no photo op. You know, I don't want you to bring no food basket. I don't need no damn food basket. If you want my folks to participate in clinical trials, then I need you to have a vested interest in what's going on in my community. I don't want you to come and tell me, well, we're going to pay you this amount of money to participate in this clinical trial. I need you to consistently come back for at least a year to tell me about what you're doing, why you doing it, how long this information gonna last, what kind of help do I need to be in to do this. You need to come in, and if we got a community basketball game, come in and participate. Donate some basketball. You want me to do something, then you do something. It's a give and take. You can't keep coming to Black folks community talking about we here to help you. No, you're not. No, you're not. I want to know what you're going to do with these clinical trials. How long is this information going to be available? And if it says informed consent, don't tell me you're going to highlight the important part. No, brother, you're going to read every word on the damn paper. And if I don't understand it, then you're going to bring somebody in here to make me understand it. That's how you get Black folks involved.
Thank you, Miss Meta. We got Mother Ray clapping, shouting. I'm gonna need Tim Parker to come off mute today.
The the best way to describe it, ladies, those listening, think back to the last time you had a physical. And as comfortable as you are in your skin and with your body, and you know where that mole is, and you know you needed your toes done. It was something about the precise moment when the doctor walked in and you had on that paper gown and you froze. In a clinical trial, think about being in that aspect, and then you bring everything that everybody has mentioned to the table. We're at a point now where we've been saying this. So why has it not been done? And let's be real. We also have to take into consideration when COVID first came out, or any health issue when it first comes out, how do we talk about it with Black people? How did we talk about it when we addressed it or made reference to it with Black people? I'll say, for instance, with COVID, I kept saying, if this is not a disease to show the difference in health disparities, because this is a cultural thing. I'm not trying to be funny, but the same thing that prevents you from getting COVID is the reason why we don't eat everybody's potato salad. We're conscientious. Like I said, the aspect of being shocked about a hand washing, we take it from that cultural view of things that Big Mama said or Big Mama did. And so now we're in a situation where the very people who are most impacted are the most valuable that need to be in clinical trials. But how long have we been saying these things? How long have we been saying, oh, we remember Tuskegee? You know, we take issue with, again, coming into our communities only at the last minute. And so it becomes this. Now that we're finally here and folks are ready to have a conversation, we've been screaming and begging for certain things for so long. Let me know when you catch up. And again, how do we address that? Making sure that the very people that we are desiring that Black folk are in clinical trials, we actually listen to what they bring, their experiences, give validity to those, and then try to address it. In other words, the fallacy of when you know better, you do better. You can't tell me anymore that you don't know better. Now we are demanding for people to do better. It is very vital and important to participate in clinical trials, but then we also got to keep in mind, lastly, from the top down, we're also taking the views of leadership across this country with us into clinical trials. So again, in understanding they are valid and important. However, we have got to actively address these aspects of it. And we got to demand to address these aspects of it, or we'll still be here if, unfortunately, the next pandemic comes around.
And so I just want to add a couple things to that. You know, right now, COVID and similar to HIV is so politicized, you don't know what to believe. Right now, Black folks, and I'll speak for myself and a lot I've talked to, because I put the question out, if a vaccine came out tomorrow that was US based, would you take it? I haven't got a yes answer yet from a Black person in the US, because we don't trust this white supremacy power structure that definitely is not for our good. So first of all, you got to deal with that. I think clinical trials, folks have said this, I see it two ways. I see it as either is transactional or is it relationship building? And it cannot be transactional. Either you're here all the time and we're talking this and we're educating all the time, or you're coming in transactional when it's politics and it's time to do something. I wanted two things. One of the first things that got me into advocacy after being diagnosed and dealing with deep depression for 4 years, and finally getting, and Kimberly, I'll say this, I'm in that paper gown, and I done told the doctor for this the second year that I'm a person living with HIV, and he's examining my breast and says, well, how did you get it? And I'm so shocked right now, I can't even speak, because I'm still not over and accepting that I got to live with this. And so tears are flowing. I can't say nothing. He's doing a pelvic on me before he looks up and sees the tears and says, oh, that's still painful. I felt raped. It was the thing that propelled me into advocacy. And I wrote a letter to the head of that medical facility to say, I'm not going to comment over his professional knowledge, but what he did had nothing, what he asked me had nothing to do. And when he asked me that, he said, oh, you probably don't remember anyway. That was his second comment. And I'll never forget it. It had nothing to do with the examination. And I laid there in that room for 10 minutes and cried like a baby on that table because I couldn't, because I was still feeling with the kind of shame and guilt that is so apparent over HIV, and it propelled me into a movement that I'm still in today. I want to say we have a huge icon that we lost in this COVID epidemic named Dolores Dockery. And let me just say this. One of the reasons when I read her story, she refused to go to the hospital because so many Black folks are being sent home because their symptoms weren't always taken seriously. It was overcrowded. She chose not to be, and to be at home with her people. We've got to do better. If it cannot be transactional, if we want to do better, because we all want to be educated. And when we get educated, we do better. But until the first thing you open in a state is the nail salon, come on now.
Okay, thank you again, Mother Ray. So thank you for that very valuable insight, and thank you for your vulnerability. Thank you for delivering that message, and hopefully some of those individuals are listening, right? And we draw parallels. Why am I in this space? Then that is the question you should ask in regards to my care. But I want to take us back to a minute to something that Ms. Meta said. Ms. Meta said that if you want Black women or Black people to get involved in clinical trials, then you need Black women, and that we don't want you to come and go, but we want you to come and stay. To that point, what are some of the considerations that y'all believe Black women should think about when considering whether or not to participate in clinical trials? Very, very important. You mentioned HeLa cells. Ms. Meta, talk about some of these considerations that you think folks should consider, specifically Black women, and how it is relevant to the HeLa cells that you mentioned earlier.
Well, when I think about Miss Henrietta Lacks, I think the HeLa cell. I think about the thousands and thousands of people who have been helped by her cells while her family lived and died in abject poverty.
And continue.
I think about that. I think about the relationship between Black women going to the doctor, and it doesn't matter whether you have Medicaid or Blue Cross, you are still not believed. You are still, we go to the hospitals for our reproductive health and we're pain seeking. If we have babies, it doesn't matter what kind of insurance you have, and you tell your doctor you're in pain, then you pain seeking. They'll just send you on your way. Black mothers have died because of this. And when we think about the role that Black women have played in medical history, in science, in making sure that Black women are thought about, we have to be mindful. I think about the women on this panel and how privileged.
Take a minute.
How privileged and blessed we are that I had sisters that helped me to understand what standing in my truth meant. There are so many Black women who don't know what to do when they go to the doctor. And I know that because I was one. The doctor would walk in and all of a sudden he walked on freaking water. Somebody was there to help me realize if they don't listen to you, fire them, that they work for you. I think it's critically important I do think Black folks need to be in clinical trial, because I don't know what that medicine gonna do if you ain't got no Black folks in this trial. But you want me to take it, and you ain't tried it on nobody but white folks, whatever kind of folks you tried it on. It wasn't Black folks, but you're telling me it's good for me, and it's not till I take it then I realize, no, maybe not so much.
Mhm.
So if you want us to participate, then educate us. Educate us. And you need Black folks to educate Black folks, especially when you're talking about medicine, science, and clinical trials. Because I don't know about nobody else, but if the white folks come into my community talking about clinical trials, 9 times out of 10, I'm going to think he's scamming me, bamboozle me, hoodwink it. So move on. Move on. We have to realize that if you don't have Black folks vested in anything you trying to do, it's gonna fail. It's gonna fail.
All right.
I would like to add to what Meta is saying from the perspective as someone who's worked in translational science. I think that everything that has been said is 1,000% accurate. I think there's a deeper truth to this, which is what I was alluding to earlier, which is the ways in which from conception to inception to implementation, monitoring, evaluation, and then the ultimate ethical obligation is to explain the science, to explain what has been done. And I think what we realize, whether you are, no matter what type of scientist you are, but if you are someone responsible for designing clinical trials, I say look to your right, look to your left, look behind you, and look in front of you. And if someone is missing from that equation, if a population, a group of people, a particular ethnicity, an age group is missing, then ask yourself, who is missing and how can I acquire the participation and involvement needed in order for this work to move forward. So, standing on the heels of on the shoulders of Betsy, an enslaved woman of the 1840s, right, whose slave master was a doctor in Philadelphia and just decided to use her as a human test subject, standing on the shoulders of Nurse Evers, who with the best of intentions. Like, let's be clear, there are some people that work in science and research that have wonderful human life-saving intentions. But even Nurse Evers, having made having to have made certain decisions, right? And then also standing on the shoulders of Mrs. Henrietta Lacks, who, the irony of her story is that she sought healthcare. She proactively knew that she had something going on. She sought healthcare. And in the ultimate state of vulnerability, the ultimate state of need, something was extracted from her body, held in isolation, right? Petri dish. I forgot what are those cells things called, Danielle, where you guys keep everything, but yeah, kind of stored, right? And then used not for thousands, but for millions, and continues to this day, right? So millions and millions, probably billions of lives that have literally been saved through the vaccines and treatment and interventions that her cells enable treatment to be, and research to start and treatment to be developed from. So I think we have to really go back to who is developing the research. And again, those scientists looking around. If you are developing research in the vacuum and you are not calling on the peers that make you a little uncomfortable, the social scientists and the data scientists like Dr. Parker that make you think differently, the behavioral scientists like Danielle that may ask a question a different type of a way. Those in community engagement experts like Stefan and Jonathan, who will tell you that your particular approach may not be applicable. Listen to those individuals. And then when it comes to partnering with other principal investigators, are you partnering with the people that will yield the response that you want to reach your clinical outcome? So if your clinical outcome is to prove your hypothesis, whatever that hypothesis is, then what are you doing to enable the environment to be reflective of that? So like I was sharing with the panelists, I don't think I shared it with everybody, but so I am in a COVID trial. This is day 27.
Mm-hmm. Okay.
Day 27. I'm keeping up my days now. And you know, I was sharing with someone that I went into the trial, you know, with some degree of bias, right? Because of my own knowledge about the clinical trial process. And so, of course, when I got into the room and I think I asked for the informed consent and for the consent form. And she said, "Oh, you didn't read that yet?" I said, and if I did, we need to read it. Oh, it's long. Okay, I'm here for it. You told me to schedule 3 hours to be here, so we're only on hour 1. So let's go. And I think the difference between the enslaved woman Betsy, the difference between those that were in Tuskegee, the difference between Mrs. Henrietta Lacks is the aspect of consent, right? I had the privilege, to go back to what Meta was just saying, to first research the type of clinical trial I wanted to be in, the type of COVID trial, to understand what the inclusion and exclusion criteria were and how it applied to me. Would my health status as it stands now be an issue? I also had the opportunity to ask questions of people in vaccine research to say, are you giving me a live virus? And if not, what portions or aspects or proteins of the virus are you going to give me, and how many? So if COVID has, 26 different strands of protein strands, then how many will I get? 3? Oh, okay. That's knowledge that I can sit with. And then more importantly, what is the follow-up process? Who do I call when I feel anything? And I think if we start from conception throughout the entire research process, then we will start to see a different outcome, a different level of participation. Last thing I would say is, one thing I've learned in my domestic US and international work in clinical trials is that people don't participate because simply no one asked them to. So I'm pretty sure if we start asking, in a humanistic, curious, non-judgmental, belief in their human pursuits for their own well-being, if we start asking, hey, Kim, would you be interested in joining a trial? And this is what the trial consists of. Then I have then opened the door and created a level of invitation for Kim to then consider if this is something for her or if this is something that will not be for her. So I think it's way more simpler than we give it credit to. Okay. I really do.
All right. Thank you for that, Kaida. I think you and Meta spoke to some very, 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 very salient points. Very, very critical.
I want to say one more thing. I heard Kaida talking about partnering. And if any clinical trial scientists are out there, she's talking about a gatekeeper, y'all, when y'all going in these people communities. Yeah. She's talking about gatekeepers. And it might not be the councilman that you're going to see. The people might not like him. So you need a real gatekeeper. And that means you got to take feet to the streets to figure that part out.
Right.
That's all.
Thank you. Kaida hit on some really, really good points, and you did too as well, Miss Meta. But I wanted to follow up to ask, why do you think it's important as a Black woman to engage in clinical trials? You spoke to it in some of your themes that you discussed today, but give us 20, 30 seconds. Why is it important for you as a Black woman to engage in?
For me, 20 or 30 seconds real quick. On my passport, it says race or ethnicity American. So it is my inalienable right for the pursuit of happiness in all ways. And if participating in clinical research enables me to have better clinical outcomes, better treatment options, and also more knowledgeable about my own health literacy, then that's the reason why I need to participate. And second of all, like, we have to believe that we belong in those spaces, that we are not being experimented on. Right? Because the truth of the matter is everything that we engage in now is an experiment. You usually don't know if you had a car recall until they send you a note. So.
Thank you for that, Kaida.
And I would just like to add in a quick 20 to 30 seconds, the running joke, everybody on the panel, I'm short. I am the shortest person on the panel. I just bought a truck. I now have road rage because I can see the cars beyond the ones to my left and right, front and back. And I get it. I'm shorter than what the average height is. Things may not be tailored to me, but I should not be excluded, and things should not be tailored to me because of my race. And it's just that important in understanding. Several of us have been in meetings where we've been sitting there as the experts or, as the gatekeeper based on race. And we've been told, well, we didn't enroll any Black women because we couldn't find them. And we're sitting there looking around like, well, what are we, like magical unicorns?
Oh, it stirs my spirit.
And if you were looking for them, then ask the magical unicorns that are sitting here how and where to find them. And so just knowing that there are going to be differences genetically in understanding clinical trials and medication, those aspects of it. However, if there's the expectation that it is supposed to be universal for all, we have got to be included and demand to be included. And you can do that and still not participate in the clinical trial. I had a Black OBGYN. On the back of her door, it said, ask me about this clinical trial. It was a fibroid study. And I'm gonna be honest with you, I was attracted to the incentives. I mean, you got a year supply of feminine hygiene products. So I was like, woohoo, I'm down for the cause. But when I asked her, she was shocked. Like, wait, you actually want to participate? And it brought back up, it brings up that sense of, it's okay for the discrepancies based on certain things, but not when it comes to race and a person's health and access to making sure that they are, in fact, included. I'm sorry, I'm shaking and using my hands. I'm passionate about that thing.
We take it, we receive it. Any other panelists want to comment? How do you follow that? If no other comments, go ahead.
Really follow Dr. Parker, okay? So much of what I do in my work is to educate other Black women or other women, other people about, I'm not here so much as about prevention, although you don't have to have this, but HIV or COVID, but I know there are structural and systemic things beyond our control that are out there that we ain't got nothing to do with. But if there's something I can do that I can be a part of the design, don't call me after you done designed it and say, come participate. Because everything that's designed is not designed with my community in mind in the way that we participate. So and one thing somebody said something about this, you know, people have a lot of good intent, but it's the impact that I'm also concerned with, because good intent, you know, gets us so far, but the impact I want folks to be concerned with. And stop trying to find us. If you were there all along, you were involved with us, you wouldn't have to find us, because we would be involved. Because I ain't got to find. I got a phone number full of Black women, but I'm not gonna call y'all for nonsense. I'm gonna call y'all for some education, and then we're gonna talk, and we can all choose differently and still respect each other. The last thing I want to say is, I want to see us healthy. I want to see us whole, and I want to see us prosperous. Being involved in clinical trials, I want to also see some issues around health, racial health disparities that don't make us having to be the ones that need to have to do this stuff in order to stop seeing the deaths of people we're seeing. Black women historically have always been controlled around our reproductive organs and who we are. And so understanding, I remember getting HIV and going through pauses. I couldn't find no information about menopause and HIV meds. I researched it. I went to the Center for AIDS. I looked, couldn't find, there might be some now, but unless we're involved, we can't find that kind of information. But the way you design it and including me from the beginning and understanding my issues will engender me to want to bring somebody else and want to be involved in the process. Not after you done design something and said, give me $10 so that you can then now do something to me that I didn't give you permission. And informed consent is a big deal. Consent is one thing, informed consent. And I'm an attorney, don't practice no more, but informed consent without him, it's assault without informed consent. I can consent to you doing something, but if I wasn't informed in the way you do it, it could be assault. So there's so much more that we need to do than just show up for a clinical trial. Let's build a relationship. Let's do something that's not transactional. And let's look.
And Vanita, I would add to your point about, you know, engaging women, specifically Black women, and I will, you know, and if your community advisory board consists of the same Black women that haven't yielded any recruitment for the last 25 trials you did, I would suggest you get another community advisory board. And that's no shade, no foul against my folks who are participants of community advisory boards, but it is to say that we all have a season. We all have a place. We all have knowledge that is applicable. There are some things that I know on HIV that are going to be applicable today that in a few years, I may need to just get on the PTA at my daughter's school. You know what I'm saying? I may need to open up a preschool. Maybe I'm not good for that anymore. So I think that level of like you said, Vanita, tokenism, you know, tokenizing, sometimes we let people tokenize us, and we tokenize ourselves, yes. Right? So just be mindful that, you know, if you're doing, you know, what is the definition of insanity, Dr. Parker? To do the same thing over and over again, expecting a different result.
Completely different
so
result. Yes.
Okay. And I think, you know, yeah. Yeah.
So Kaida, you talked about caps. You talked about alludes to opportunities for individuals to get involved in efforts. Right. So there's a question from the field. And
hey, welcome question.
All right. So this individual is asking, where would you recommend that I begin to outreach, educate, and involve myself in the community as a Black female clinical researcher in San Diego?
And do you know the ethnicity of the person, Danielle, asking the question? Is the person of color or?
I'm gonna take a stab.
Should we assume?
I would assume.
Okay.
Miss Kate.
So, yeah, if I may, I would say that first of all, beloved researcher, scientists, thank you for what you're doing and how you are choosing to spend your life and leave your legacy. The first thing I would recommend is for you not to operate in a vacuum. And what that means is identifying another or other Black researchers. Some of us may not necessarily want to do the exact same type of research that you want to do, but that's okay, right? Because when we look at diversity and we look at inclusive environments and equitable environments, oftentimes we have to be mindful that a diverse, scientific approach may be the best approach. So number one, partner with other researchers so that your work has more depth. The second thing I would say is whatever population you are, because all research is asking a question, right? So whatever community, whatever disease state, whatever you're asking the question about. So if it's COVID and Black folks, investing and immersing yourselves in the people and their cultural norms, in how they move and organize, and then ask questions, ask a lot of questions, make yourself open and vulnerable. Unfortunately, there is no like, here, I'm gonna give you these 3 things and go do these 3 things and you're gonna meet all of your, you're gonna meet your 50% standard and the FDA and NIH is gonna be so proud of you. No, that's not how it goes. But I think we have some wonderful examples of people that have engaged in clinical trials throughout the world to learn from and to glean from. So, putting yourself out there and checking your ego at the door whenever possible so that you understand it's not about you, but it's about the work that you're trying to do.
Thank you for that, Kaida. And then to the individual who posed the question, there was also some advice from Mother Ray, who said, show up in spaces and listen, right? Actively listen to understand the circumstance. You talked about disproportionately affected communities in your post. We are giving you, right, the tools that you need to go out and immerse yourself in communities who live with these conditions on the daily. So we do.
And Danielle, listen with your whole body, listen with your eyes, listen with your ears, listen with your heart, and know that authenticity, you can't shield that. I don't care how many, what Ms. Meta talked about, the shield between her, but I'm pretty sure that authenticity is like a ray of, like a Venita ray of light. You know what I'm saying? Like a Venita ray of hope. You can feel authenticity, and then I can feel BS too. I can feel when you are really just focused on whatever your goal and intention is. And if it's transactional, then I'm going to be focused on mine as well.
Indeed. Brother Ray, can you come off mute and read this last comment, please? It is critical.
So I started practicing law in Washington, D.C., 64 square miles of some tough battles, y'all. But I learned a lot and still got some scars from it. But and what I found when I worked in communities, which is what I've been doing for years, is they don't always need a lawyer. They need somebody to sweep floors. They needed somebody to do windows. I needed to be present to serve. And then I might have got a chance to serve in another way that my legal education offered me. And I typically did, but that wasn't the way I got to serve a lot. I spent a lot of time, folks just walking me around the neighborhood showing me this used to be over here, that used to be there, or whatever. So I do windows. I always say I'm a lawyer. I'm not practicing no more. I'm a lawyer that do windows. I serve where a community needs. And at the end of the day, I then get to help you in ways that I have some expertise of.
Thank you for that. All right, y'all, we are approaching the top of the hour, but I do have another question. Maybe 2. I don't know. Yeah, I'm gonna use some facilitator, moderator privilege, damn it. So what are you all doing to support the involvement of Black communities in clinical trials generally, and specifically those that are related to COVID-19? What are you all doing? 1, to support Black communities' participation in trials, and 2, of those trials that are specific to COVID.
I'll jump in and start. right quick. As somebody who promotes African American participation in clinical trials, I think the first thing that we should do is be able to speak from experience. Every clinical trial I have ever tried to enroll in, I was rejected for, one reason or another. But I can also say that when I was trying to enroll in my fibroid study, and I'm gonna just be honest, I had to submit those free sanitary napkins because that was how they weighed my, the flow to see if I actually qualified. But in doing so, I had to carry a cooler to work, and I had to keep in store. So if I was in the office for 8 hours a day, I'd take that cooler with me, because if I had to change that pad, I had to wrap it up into the clinically approved plastic bag and then put it in the cooler. And I remember telling them, I'm kind of happy I didn't qualify, because I wouldn't be able to do this for 6 months. And so just being able to address it from that realistic standpoint, go through the process. I think that is very important. Or again, an understanding, if we want female or Black women to participate, if I got a job, yet I got to do the clinical trial enrollment between 11 a.m. and 1 p.m., that job that pays those bills are going to come first, even if I feel so passionate about being involved. And so I think that is key. Understand that experience and then live that experience before moving forward. I can say, I can say that Blacks tend to be excluded from clinical trials, but I could describe it the minute my OBGYN said, wait, you want to enroll? I mean, I didn't think you would be interested. So I think that's a key takeaway in understanding what we are expecting or asking people to do or take into consideration.
I would say ask them. Let's just ask. Let's just keep asking, keep educating, keep informing. For me personally, whenever I have an opportunity to share with someone I'm in a clinical trial, it's interesting because with some family members that I share, they were like, oh, okay, why'd you do that? And, they never said, Vanita, they never said like, for the money. Good. Yeah. Okay. If anybody knows Inyasha, they know that is a trip. So it wouldn't be the money, right? But for me, usually my response is, I do it for all of our ancestors who never participated in informed consent process, right? They were never afforded that opportunity and that privilege to say yes or to say no. The other reason why I do it is for my daughter. She's 12, she cannot participate. I also do it for specifically for COVID, for phase 3 trials. People living with HIV are excluded. So I do it for people living with HIV who cannot participate in the trial, not because anything is wrong with the person living with HIV, but because some of the people, again, developing the science, did not know, right? And at the beginning of those trials, but like Vanita just said, in some of the trials, enabling folks to participate now is another. And I think also I do it for just elderly Black folks who literally are held captive in their homes right now for fear of dying or fear of suffering unnecessarily. And they want to participate, but they're like, yeah, nah, you're a youngin', go on out there and do it for us. And so I'm a little bit healthy, just a little bit, not healthy as a horse, but maybe a gerbil or something, but enough so that I will share with people what I'm doing, how I'm doing it, and some of the questions that they should consider asking if they would like to consider joining a trial. So
Thank you for that.
And you're beautiful.
Thank you.
I'm
but
gonna say
Vanita, the other thing is really quick. because, you know, we all kind of showed up here today and washed our faces, because that's the thing about Black women. You know, even during the pandemic, we be like, Mississippi, goddamn, what you're not gonna do is find me crusty. You will not find me crusty, and you will have some good light so that neckline there below the neck, yeah, the below the neck don't look too good.
I thought this had been canceled, so I was prepared. I thought this had been, I got up at 6 this morning and worked through this and then thought it had been canceled, and then saw an email and I said, oh my God, it hadn't been. And so I jumped to show up, because I'm not so worried about, yeah, we can make it work.
That's what we do.
I'm more worried about the information. And I'll tell you, I've not been a person involved in clinical trials. The only reason I'm here is because Stefan Wallace sent me an email and said, and we're busy. I'm up to here with work, but I said, I can't, how can I say no? And we got 300,000 women that we know of living with HIV, never mind COVID. And so I said, I don't know what I could do, but keep me in the loop. And then when he said this, I said, this ain't the loop I meant. And then you were meant to be a part of, though. We had to fight for people living with HIV to be included in clinical trials. Moderna first came out and said no. But then, you know, I've talked to Brian Manalga, I've had a conversation with him. So now I'm trying to figure out, how do I get this information to my folks? Because I don't want my folks, when I say folks, I mean women and trans folks living with HIV, for stuff to come out and we not have any information. So I'm here with this much knowledge on here, trying to say we need to know something. And then when I developed the ending the epidemic plan for the city of Houston, one of the things I included in there was policy and research, which you don't see in an ending the epidemic plan or prevention and services. And the research in the standpoint, the same thing we're talking about: inclusion, design, participation, and all of those kinds of things. It needs to be part of the care system, and it doesn't exist. So I'm here to learn from y'all, because Kaida and Dr. Parker, I've been watching and listening, but I ain't been, you know, I've been busy, but I need to pay more attention.
Thank you very much for your comments, for your shout outs, and thank you to everybody who's asked a question. I got one more question, and answer it as part of your wrap up. I'm clear that we are at the top of the hour. We are long-winded.
But you know, it's a pandemic. We don't get to have fun like this not often.
I hear you. However, respect for folks this time. Take 30 seconds. I'm clear. 30 seconds. And then your 30 seconds, when you do your acknowledgments, shout outs, prayers, you know, all of that. Answer for me. If a safe and effective vaccine were to come out today, would you take it? And then wrap up your last statement. Be brief. 30 seconds. Go. Anybody can take themselves off mute and chime in. Go for it. Mother Ray, are you coming off? Are you going on?
I'm coming off because I don't know. US based, I ain't with you right now. I'm gonna be honest with you. US based, I gotta feel that this is not politicized, and US based don't have. I need more information.
Okay. Thank you. Any closing remarks in your 30 seconds? 27? Closing remarks. Wrap it up.
Closing remarks. Black women, when Black women get better, we all get better.
Amen.
When we educate our communities. So talking through us, knowing and teaching us is the way to lift the community. And when our Black community get better, every community get better. Amen. So I'm here for it.
All right. Next.
I'll go next. Would I take it now? I would like to say that I would take it, but I would have to get over the politicized aspect of it. In closing, I will say to the participants, especially Black women, know that your experience is valid. For instance, a majority of Americans wouldn't take it. And if the focus on that component is not enough to make it feel or understand that it matters, you matter, we matter, our experiences matter. Michelle Obama said it best: when I realized nobody was going to fight for me, I had to demand it.
Indeed.
Demand it from this point forward.
Thank you. That was powerful. Next, Ms. Meta, give it to him. 30 seconds.
I was born in the 1950s, baby. Hell no. Okay? I was born in the 50s. I'm not taking no shot that the white people done hooked up, and I don't know what it's gonna do. Now, when some black folks start taking it and they ain't dropping like flies, then I'll line up. And the last thing I want to say is for black women on this call. Get in the habit of looking in the mirror every day and telling yourself, I'm all that, I'm a walking all that, and anything that's not that is just chewed up grass.
Come on, Miss Meta, serve it, girl. I love it. Last but not least, Kaida D. Peppa.
Yes, Dimu Tepfa. So yes, I'm gonna take it, and this is why. My daughter was born in Mozambique, and they gave her the MMR and Hep A before she left the hospital, and I didn't ask a question. Her dad and I didn't ask a question. How was it developed? Where? Who was it trialed on? All I know is my 3 days was up after delivery, and I wanted to get out the hospital. So this little girl needed to have some shots. I know also that my better days will not be spent in the United States of America. Sorry, Miss Meta, but I got to go. Deuces. And because of that, I don't want to take none of my nasty to none of my people on any continent. So if it ever comes a time where a prerequisite to flying, traveling is that I have a vaccine, and the COVID vaccine is it, and that will enable me to leave and to have a life and to breathe and to commune with people and not take them my nasty, then yes, I do intend to do that. So my shout outs are, I have to give it up to Stefan Wallace. If y'all can just snap him up right now, because we have been on the journey. Yes, we have been on the journey with Stefan, and to see where you are is absolutely amazing. I thank you. I thank Michelle also for just even your creation of what you all did with the COVID Prevention Trials Network. And more importantly, I thank Lewis, and I thank all of us that work in corporate, and you know who you are. I know this is not an easy time for us, but this is our time. 100 years ago, our ancestors would have never imagined being in this place at this time, doing this work. So although you may get weary, hold on. It's cool. Just keep holding on. And last but not least, thank you to Danielle. I had the opportunity to just see you grow and blossom over the years. I have shameless plug. Danielle was a volunteer intern of mine at UCLA back in the day, and just to see where she was, I know you forgot, huh? Where you were and where you are and where you're going, your path is bright. So thank you all so much. And thank you, Black people, for loving Black women. For those that sacrifice your lunch to join us today. Thank you.
And with that, I will close us out. Kaida mentioned Dr. Stefan Wallace, Louis Shackelford, and the other folks behind the scenes that work to support this webinar today. On behalf of the COVID-19 Prevention Network, I want to thank our panelists for taking time to speak with us today, sharing their voices, experiences, and themselves to bring attention to some very important issues in a time where we are all looking for answers and a way forward through this uncertainty. Thank you to everyone who just tuned in. Thank you to everybody who asked the questions. We are through. It is 1:07 Pacific Standard Time. Peace. See you next time.